There is concern the coming months could create a twindemic.
COVID is continuing to surge, unfortunately. Doctors are now warning the flu will also be a major threat over the next few months.
When the flu does come back, and it will come back, it's going to come back very aggressively.
Health experts are warning that this year's flu season could be much worse than last year's. The CDC says from 9 million to 45 million people in the U.S. get infected with the flu annually, leading to 12,000 to 61,000 deaths. But that wasn't the case last year. Last year's flu season was nearly non-existent. Public health and clinical laboratories reported only a few thousand cases of the flu for the season. And the COVID pandemic is a big reason why those numbers were so low. WSJ reporter Felicia Schwartz has been reporting on the upcoming flu season.
All of the experts and virologists that I spoke to in the course of reporting all of this out said that there will definitely be more flu than last year. And it could potentially be an earlier and more severe season just as a result of kind of the weird dynamics last year.
The flu virus can spread to other people through exposure, mainly from droplets made when people who have the flu cough, sneeze, or talk. Less often, a person might get the flu from contact with surfaces that have flu virus on it. And since the start of the pandemic, health experts have found COVID-19 spreads in much the same way. During last year's flu season, with the rollout of COVID-19 vaccines just getting started, much of the U.S. was in lockdown. Social distancing guidelines were in effect, and many people were masked. All things that help prevent the spread of COVID and also help prevent the flu. Now, COVID vaccines are widely available, and people are interacting more.
People are back at school, back at work to some extent. Depending on where you live in the US, there are or aren't social distancing restrictions like mask wearing and, congregating in large groups and so on. And so there is a lot more opportunity for the flu to spread this year.
As a population, there's also less immunity to the flu this year. Population immunity occurs when people are naturally infected by the virus or have received a vaccine. Since so few people were infected with the flu last year because of social distancing, people haven't been able to build up their natural immune defenses. This lack of immunity could contribute to what some health experts are calling a twindemic. It refers to the threat of a severe flu outbreak on top of the COVID-19 pandemic, which could be detrimental to the healthcare system.
I think the fear from health authorities is that hospitals could be further overwhelmed. One hospital administrator was telling me maybe they'd have to cut back on clinic hours or reschedule other procedures. If they're having to make these kinds of choices, they might have to scale some things back.
This overlap could also cause confusion among people about whether they have COVID-19 or the flu. Because they have similar symptoms, it could be hard to diagnose which condition people have based on the symptoms alone. The main difference between the two is that COVID symptoms typically appear about 5 days after infection, but symptoms can appear 2 to 14 days after infection. And flu symptoms usually appear about 1 to 4 days after infection. The good news is the best ways to prevent catching the flu are the ones many people are already familiar with.
Infectious disease experts and epidemiologists really urge you to get a flu shot. On top of that, hand washing, good hygiene. If you're already wearing masks and practicing social distancing for corona, that definitely can't hurt you if you're looking to avoid catching the flu.
The flu season commonly strikes the U.S. October through May, with cases peaking in December through February. So the CDC recommends getting a flu shot every year by the end of October to get ahead of it. The CDC says you can get both the flu shot and the COVID vaccine, including boosters, at the same time, which wasn't the guidance last year.
The shots were so new, they didn't really have enough information to make that recommendation. But now they're saying, yes, you can go get those 2 shots at the same time. So depending also on the booster campaign, maybe there will be some more co-administration of shots.
As far as side effects from taking both the COVID vaccine and the flu shot at the same time, the CDC says the side effects people experience are similar to what they experience when the vaccines are given separately. Some pharmaceutical companies are even working on a combined flu shot and COVID vaccine that could be administered in the same jab, but there's no clear timeline yet on when those would be available. While experts believe this flu season could strike earlier and more severely than usual, there's still no guarantee it will be.
One person I interviewed described it to me as a tricky devil. It's very hard to predict. So I think there is a general feeling that it will be worse. And some people think it could be very bad, but it's kind of hard to know at this point. If you're worried about the flu, probably the single best thing you could do is go out and take a shot.